Well, good morning, Neomed. I'm especially happy to provide you a campus update on this beautiful spring day in Rootstown, Ohio. We are now on the home stretch for our senior students as they prepare for commencement on Saturday. Even with the constraints of the pandemic, this is a week full of traditional ceremonies held in a non-traditional way to recognize and reward the achievements of our outstanding students and the faculty and staff that have gone above and beyond expectations to assist them. I hope all of you will be able to join us for the virtual commencement this Saturday morning to celebrate with our students and their families. This is the culminating event for their time at Neomed as they take away the knowledge that they have gained to become scientists, pharmacists, and physicians and apply them to the next level of their professional training, or for some of them, as they go into early practice. In line with this week's theme of celebration, I ask that all of you please join me in recognizing some of our outstanding faculty and staff. To start, congratulations to Dr. Haki. He received a prestigious R01 grant from the NIH Institute on Aging for his proposal on mitochondrial dysfunction and Alzheimer's disease, building upon Neomed's impact in the area of neurodegenerative disease research. And a big congratulations to Dr. Boltry, who also received a grant, is from the Charitable Healthcare Network to support caring for the uninsured in our SOAR student-run free clinic. In the past several weeks, several of our students completed the daunting task of defending their dissertation or their thesis. Brianna Guarino completed her dissertation defense for her PhD in the IPM program, and Emily Myers, Samuel Dorley, and Catherine Wu completed their master's defense. Today, Catherine Pathmasason will defend her master's degree at 1 p.m. and I encourage any of you available to be able to attend. As you know, we have been working to increase our recognition of the accomplishments of our outstanding faculty and staff at Neomed. One of the new programs introduced this year is the Neomed President's Excellence Award. These awards are given to our most outstanding team members, recognized and nominated by their peers in the areas of teaching excellence for both basic and clinical faculty, and for a staff member who has demonstrated excellence in continuous quality improvement. The awards will formally be given to each member on May 28th at our Board of Trustees meeting, along with a monetary token of appreciation. However, I'm pleased to share with you the winners of these awards today. It was a very difficult process as we had many really highly regarded and highly qualified faculty members. But to tell you who the winners are, the first for the President's Excellence in Teaching Award at Rootstown is Dr. Julie Altman. And the President's Excellence in Teaching Award for clinical faculty is Dr. Mary Massey Story. And the President's Staff Excellence in Continuous Improvement Award goes to Ms. Sarah Brickley. Congratulations to all of them. We look forward to recognizing you formally with a certificate with our Board of Trustees at the board meeting on May 28th. A big thank you to the team that ran the William Carlos Williams event last week, supporting the teaching of humanities and medicine. Many of you may know that this national poetry competition in medicine was started right here at Neomed back in about 1982, with the first event being held in 1983. This year was a wonderful event that was highlighted by the work of Dr. Amit Majmudar, a Neomed alumnus and radiologist, who is also the former Ohio Poet Laureate and has been recognized for his work nationally. This, along with the winners of the competition for multiple places, sharing their poetry with us for the first time. So wonderful work. Thank you to the team that pulled that off for us. I also want to thank all of you for your efforts and support for the new zero-based budgeting process. I know this is a daunting task. Many people went through this, were concerned about the difficulty, this new way of thinking, but it has really worked well for us. I do especially want to thank Ms. Marilyn Ward, Mary Taylor, and Jackie Kovac, who spent countless hours on this budgeting process, far more than the rest of us. We finished the formal process last week, and we conducted a debrief with the vice presidents and the deans on Friday. The results were excellent, and I believe everyone walked away from that meeting feeling very content with the results and the process. We are now preparing the budget for the Board of Trustees endorsement. The budget is not official until our trustees have given it their approval. They have the fiduciary responsibility to review all key financial movements here at the university. More details will follow once the process is accomplished with the board, but I will share with you that the increased budget proposal that we have provided for their review will include new positions for undermanned areas at the university, funding for critical new faculty positions, funding to increase compensation for our current faculty and staff, funding for professional development resources for faculty and staff, in addition to new and stronger student support services. We have proposed a substantial financial allocation also for our strategic plan implementation group to be able to utilize as a resource to help us meet the goals and objectives of our new strategic plan. We are putting our money where our mouth is. We are actually being able to provide these resources so that we can empower our employees to be able to move the strategic plan forward. So thank you to all who've been involved in this process. Really, the results are outstanding. We have done a very good job here at the university at being good stewards of our financial resources in applying Lean Six Sigma principles that have allowed us to take dollars that were being used in wasteful ways and to repurpose those towards our focused mission elements. As a note to the COVID update, after careful review by the CDC and the FDA, the governor has permitted a continuation of the Johnson & Johnson vaccines that were provided to us on our campus for students. We are still waiting for some feedback from the governor's office regarding the allocation of those, but if authorized, we will resume offering those very, very shortly. I also want to thank Summa Healthcare, who's offered to send out a mobile team to provide vaccinations more broadly to students, faculty, staff in our community, and we are currently working with them on dates when that would be available, and we'll keep you apprised of that. And also a thank you to Mercy Bon Secours in Youngstown, who's offered to let any students who need a vaccine come out to their facility and get vaccinated, so that there are plenty of vaccines available for our team. We've only had one new case reported since the last time that I spoke with you. That was with an employee. My understanding is they are doing well at this time. And we are working on revising our COVID policies. Dr. Zarconi, Erica Stavsky, and Jesse Zampedro have been leading that working group in conjunction with the IUC, the Inter-University Council of Public Universities, to work on a standardized process through which we will implement changes as we begin to see the pandemic likely winding down. For those of you who followed it, you've noted that Ohio has done a very good job and our case counts continue to drop. The way we can ensure this continues for the long term is to get vaccinated, and I encourage all of you to please do so. I also think it's important that we recognize two of our critical team members at the university who've done so much for us and unfortunately will be leaving us after a number of years of outstanding service. Dr. Dana Peterson, who's been an important member of our Department of Anatomy and Neurosciences, will be leaving us at the end of the month. She has got a wonderful new opportunity to help launch a satellite medical school campus in Pennsylvania. She has been an outstanding member of our community, an advocate for underrepresented minorities, an advocate for her students, and a frequent winner of the Top Teaching Faculty Awards. And of course, what could we do without Ms. Anina Picorni? Her years of service to our students have been recognized over and over again. And unfortunately, we lose her, I believe, on May 27th. I wanted to recognize her now, while we may still have some of our current students who will be graduating, attending this meeting today, just so we can once again say thank you to her as she launches off into retirement in a new stage of her life. And finally, please join us tonight, if you're able, at 5 p.m. for the annual Student Leadership Awards, and then tomorrow for the College of Pharmacy Match Day celebration and the Department of Family and Community Medicine Awards. These are some of the many events that are taking place across the campus this week to recognize our graduating students and the faculty and staff who've been involved in their education as we get ready for commencement on Saturday. And with that, I will stop and open it up for discussions as always.
Yes, the first question is, why has our pharmacy costs increased so exponentially from last year? Also, will there be any incentive to purchase medicine from the Rootstown Community Pharmacy as it has been in the past?
Well, I can't give you a solid answer on costs going up. This is the first that I've heard of this, so we will look into it. We do have a different plan that does have what was thought to be a more comprehensive pharmaceutical coverage than that which we have had in the past. I'm going to ask for a review by our HR team who handles benefits, and we can see if we can validate that. And if that's the case, we can talk to SUMA. But I don't know the details. This is the first I've heard of it, so I'm going to ask you to give me some time to figure out the details, and we can readdress this with the group at the future updates. The Rootstown Community Pharmacy is currently operating as normal. It will be part of the SUMA consortium of pharmacies and will be covered by our healthcare insurance that we have through SUMA. There's more to come on that we're not quite ready to share. As SUMA is continuing to build a bigger footprint on our campus, I believe that pharmacy activities will become a key part of that for the future.
Will Neomed ever consider a full 360 mid-year/yearly review to include feedback on our leadership roles?
Well, to ask the question, will we ever? The answer is always yes. We'll consider. I'm not sure what it is you've got in mind. We are doing 360 reviews, and we'll continue to do 360 reviews on our leadership at the university. And we hope that we'll be expanding that more across the board, not just to include leadership, because what you traditionally call leadership is really not the only leadership on this campus. Every one of our employees has a way of being a leader, and I think we need to look at everybody to give them a fair assessment through a 360-degree review.
The next question is, do we plan to continue the Summer of Wellness program at the end of May?
Yeah, so we get this question frequently, and you got it last year, and the answer then was yes, and our intent is to continue that. That is being managed by HR. I have not been approached this year yet by HR about this process, but I certainly support it.
Are there any plans to make the FWA permanent and a part of the benefits package, particularly for staff that typically struggle with work-life balance and wellness?
As I've shared with you at these updates over the course of the last couple of months, we are looking at that. Our intent is to have learned from the pandemic. We definitely have cemented in the variation in work hours, meaning coming in early, leaving early, taking extended lunches. That has all been worked out as a formal process for the future. We are currently looking at our flexible work hour process also around being able to allow members of our team to periodically work from offsite, as you've been doing during the pandemic. Currently, we allow that 2 days a week. My intent is that we'll continue some form of that. We just need to get a good grasp on what impact it will have on students as they come back to campus full force, at least we hope full force, in the next academic year, which will begin in late July. Currently, we are meeting their needs, but they have a very minor footprint here. As that footprint returns back to pre-pandemic levels or potentially close to those levels, we need to make sure that we have enough staff and faculty presence on campus to meet their needs. So this may mean a change in that flexible work arrangement so that it moves to the opportunity 1 day per week. It may stay at 2, but that's something we'll be looking at closely.
Previously, it was indicated that employees' fitness program was being reevaluated and alternatives or changes to the Sequoia plans were being considered. Are there any updates on that?
I do not have any updates for you on that. I'm working again with our HR team on what that's going to look like for the future. As we've gone to a new health insurance process, I believe actually I have a meeting in my calendar in the next 2 weeks regarding wellness with the HR team, but if not, we'll make sure that happens.
I appreciate your message following the guilty verdict of Mr. Chauvin, and I support equality, diversity, and inclusion. However, as a healthcare provider who has worked closely with law enforcement for decades, I'm concerned for the lack of a balance in statements recognizing the importance of law enforcement in our communities and the critical intersection of medicine and law enforcement. While one bad doctor is not reflective of the practice of medicine, the same applies to one bad officer. What can we do at Neomed to show the importance and value of law enforcement in our communities? And how do we partner with our law enforcement colleagues in the quest for equality, diversity, and inclusion in our communities?
So I think we've done a very good job on our campus with that. We recognize and value our campus police officers. Our chief of police has been a big advocate for getting this out publicly. In fact, you may have noticed our chief of police has come out and personally attended many of the diversity events that we've held on this campus. She's worked on a key program to focus on communication, to getting her officers out publicly to show support for our community. And you're right, one bad officer, multiple bad officers, we know that they exist out there. Our goal is to make sure they don't exist on this campus. And as a group of individuals who support our local communities, we need to do more to ensure that this is also the case across the region and across this nation. There are bad doctors out there. We know that's the case too, but we can unify and have unified on this campus to support justice and equity for all, and we will continue to do so. I don't think you can clearly watch what's taking place on this campus and really have a good understanding for what this community is actively doing, at least to be able to say that you do, without understanding the huge number of initiatives we put in place around diversity, around safety, around social equity and social justice, as well as building out new programs to ensure that we are creating culturally competent practitioners coming out of here, or at least as competent as that we can make them. So there have been a large number of resources put into this, and I think our chief of police has created an exemplary workforce. So I ask you to support them, reach out to them, talk to them. Our officers are people, our officers are caring people who are here to support this campus and to support every single person on this campus equally.
There are no further questions at this time.
Thank you, Michael. And thanks to all. I look forward, I hope to seeing all of you at commencement on Saturday.